Regardless of what you're going through, what crisis you're in, you can always call 211 and we'll do our best to assist you in any type of way.
Well, Indiana 211 is a free and confidential service that connects Hoosiers to the local resources they need, including mental health counseling, a service that has seen a huge spike as the pandemic drags on. Within the first month of launching Indiana's Be Well Crisis Helpline, mental health counselors have fielded more than 1,200 calls. The Indiana Family and Social Services Administration launched the hotline in late July. Business of Health reporter Kylie Veleta has more. Kylie.
Thank you, Gary. The Indiana FSSA opened the Be Well Crisis Helpline as part of Indiana 211, which was brought under the FSSA umbrella also in July. By simply dialing 211, callers can connect to state and local services to support their overall health and well-being. And mental health is certainly a critical need as everyone is feeling higher levels of pandemic-related stress and anxiety. Joining me now to tell us more about the crisis line is Dr. Jennifer Sullivan, Secretary of the FSSA. Dr. Sullivan, thank you for joining us today.
Thank you for having me.
Okay, so callers can pick up the phone and talk to a counselor 24 hours a day, 7 days a week. Explain why the state saw a need to start this helpline and staff it around the clock.
Well, we saw indicators very early on that the mental health and well-being of Hoosiers was suffering as a result of the things that we asked people to do in our pandemic response. Not only do those with existing mental health conditions need additional support, but also those who've never really had to deal with anxiety, depression, or the consequences of being disconnected from their support networks. Add economic uncertainty to fear for the health of you and your family, and it requires a comprehensive, easy to access, and free resource. The helpline is a part of a huge package of mental health supports that we've put together, including telehealth, substance use disorder policy changes, the Be Well Indiana website, and more. And even though it's not enough, it's a huge start in making progress and very promising.
Right, and convenient. The crisis line is part of Indiana 211, and in July, the state brought 211 under the FSSA umbrella. So that sounds like a policy detail to the average person. What's the significance of that?
Well, our pledge to Hoosiers is to deliver human services with compassion and equity. And adding 211 to our family of services for confidential, free connectivity to resources, or sometimes just a kind person to talk with, is a powerful step in realizing that goal. Since our entire portfolio is shaped by the social drivers of health, bringing that community, state, and federal connection into the fabric of our agency was a natural next step.
Okay, we've been putting some stats up on the screen from the helpline. More than 1,200 calls in just the first 5 weeks. Average call is about 20 minutes. And the top two distresses, isolation and withdrawal, and fearfulness and anxiety. What are your big takeaways as you see some of those results and some of the stats from the crisis line in just the first 5 weeks or so?
Well, first, I'm so heartened that people are using the resource and that we were able to quickly build a diverse team of highly trained experts to field those calls in partnership with Mental Health America. Second, I'm really struck by the acuity of the calls. People are hurting, and we need each other now in really profound ways. People are calling in acute crisis, not just chronic needs that need additional support. And lastly, a critical key to our recovery is going to be accounting for the trauma this pandemic has wreaked on our mental health and mitigating its long-term effects on our overall health. And this helpline, I believe, will play a part in keeping us informed about what is happening in people's lives in real time and how we can and should respond in our global mental health network.
Also close to your heart are health inequities that have been worsened by the pandemic. Does the crisis line help address those at all?
It does. The pandemic has put a microscope on the gaps that are present for achieving equitable health outcomes in Indiana. And this has been a priority for Dr. Box at the health department and me even prior to these events. We know that a stress on an imperfect system doesn't make it better without restructuring the system itself. And I believe that our renewed focus on data and understanding the overarching health needs of Hoosiers is really critical. Not just healthcare like doctors and medicines, but things like safe housing, access to food, education, dismantling racism, and ending stigmas. And the Be Well Crisis Line is part of that overarching mission, and I hope can act as a bridge as part of 211 to not only fill needs now, but build healthier and more equitable communities moving forward. I would also encourage you to check out our new Health and Wellbeing Atlas. It's on our FSSA website for more about how we're using data to drive this work for real people having real problems every day.
We only have about 30 seconds left, but as you look at this mental health crisis, is there a message you could share with businesses or private companies?
Absolutely. Look out for your employees. They may not tell you they're hurting if you don't ask, so please ask. Do you feel safe? How can I help you today? Would you like to talk? Be kind and patient with all the uncertainty that still exists, and understand that people may not be acting fully like themselves right now. A little grace will go a long way. If you see red flags, don't let them go. Make a referral, call 211, and you may just save a life.
Okay, and we mentioned bewellindiana.org, also a good resource. Even if people don't feel like they need to call the crisis line, they can always jump on that website. Dr. Sullivan, thanks for being on the show today. I know this is an ongoing long-term issue, so I'm sure we'll be checking back in with you.
Thanks for having me.
Gary, back to you.